This is For the Love of Community Engagement, a podcast to inspire better public participation. We bring you the latest insights, innovation, information, and interviews from across the world. Visit fortheloveofcommunityengagement.com for show notes and more. And here's your host, Becky Hirst.
Hello and welcome to Season 5, Episode 2 of For the Love of Community Engagement. And this season, of course, I'm calling it the Becky Edit. I'm having a bit of fun after Season 4 was quite a heavy one. I've decided that this season is going to be all about just things that catch my attention, things I love. I've got some friends lined up to talk about stuff that I'm interested in and that affects me, because I'm more than just a job title. And as we know, community engagement is often more than just engaging. It's about community, it's about sharing, and it's about talking about the things that interest us. So I hope you're enjoying the season so far. I can promise you episode 2 is going to be a pretty cool one. But before I get into the episode, I want to acknowledge that the land I'm recording this podcast on is the land of the Ghana people. It always was, and it always will be the land of the Ghana people. This is an ancient civilization that we have had here in Australia. I think it's the oldest living culture on the planet. And ever since I was called out for not doing a acknowledgement of country during season 1, I didn't know it was something people did on podcasts. Ever since then, I've decided to always make a bit of a thing of it ahead of each podcast and try and connect it in, try and actually learn something, try and reflect, think about what the first people of Australia have taught me as somebody that moved here about 20 years ago. So when I was thinking about this one, I was thinking, gosh, what would a Ghana elder say in relation to what we're going to be talking about today? The world of ChatGPT, the world of artificial intelligence. And you know what it got me thinking? It got me thinking about the stars in the sky, and how an elder once talked to me and told me that they believe the stars in the sky are actually, it's their ancestors sitting around campfires up above us. And I've always looked at the stars like that ever since. And I think that's a beautiful way to be looking and thinking about ourselves in terms of big perspective, and that we are not the be all and end all. The human race is just one part of a massive, massive ecosystem, whether it's about the sea, whether it's about the forests, whether it's about animals. My 13-year-old at the moment gets quite freaked out when she thinks about every single person has an entire life story of their own and has all of their own individual interactions in their own story. And so this got me thinking, AI and ChatGPT is just another layer. It's just another system that is now in this universe. And it's a layer that affects us as human beings living on this planet. It can help us. It can also hinder us. And we're going to be talking about that later on. So I think in relation to my Ghana acknowledgement, my acknowledgement of country today, I really want us to just think about us as human beings being not the be-all and end-all of this universe, that there are many, many systems at play, and we are just one tiny fraction of it. I told you this is the Becky Edit, getting into the real deep thinking here, and I love this stuff. Before I get on to the actual fireside chat, I haven't got a specific sponsor for this season, so I am backing myself. HeyEngage.world is where you'll find all of my training. I've currently got 3 trainings on there. They're all on demand, so you can register straight away and get instant access. And each training comes with its own workbook. It's divided into different lessons. I've got the famous Community Engagement Boot Camp on there, which has got 6 different modules. I think there's 5 lessons within each module. And I'm getting really great reviews. One council has even got 30, 35, maybe even now 40 of its staff doing the Community Engagement Bootcamp, which I absolutely love. So check it out, heyengage.world, and you can find my 3 training offerings there. Also, of course, let me know if you need any in-house training yourself. I'm more than happy to come and work with your team or your organisation to bring the Becky vibe, bring the energy, and of course, bring all of that extensive experience in community engagement. More than happy to do that for you. So just give me a shout. Getting us on to today's episode, I am joined at the fireside by the one and only Tessa Kowaliw, who is somebody I've connected with over the years, specifically in the health consumer space, initially, way back. And we do talk about that connection. And in fact, we'll even share our birth stories with you. I told this was about human. It's the Becky Edit. We also talk about her use and extensive expertise of artificial intelligence and ChatGPT. Tessa's a really strategic thinker, and I've really enjoyed following her thought leadership on TikTok specifically around ChatGPT and artificial intelligence and how it's really shaping us now, but also how it's going to shape the future. And we have a really, really good chat. Get ready for this one. And it's all about thinking how we as consumers, specifically health consumers, can use these tools to our absolute advantage. I also want to come with a bit of a warning, and that is that ChatGPT and the use of artificial intelligence is relatively new for us as human beings. It's shiny, it's exciting, but the chat Tessa and I had after we'd stopped recording was about our ethical responsibility as professionals to not serve the world with AI slop. Please stop. If you're using this to just create generic, let's call it rubbish, to post to try and make yourself look good, please stop. This is not the best use of AI. We can be using it so much smarter than this. So I wanted to really flag that responsibility, that ethical responsibility that we have as professionals in using AI. The second disclaimer I wanted to make is you use AI as you see fit, but please don't rely on it entirely. It's particularly relevant in relation to Microsoft, whose product is actually called Copilot. The artificial intelligence isn't the pilot. It's not the one leading the way. You are the one leading the way. And I really want to make sure that you don't overuse it and let the AI become the pilot. This is about the human experience and how we can use AI to support us. The more we use AI, the more we rely on ChatGPT, the more cognitive decline we may see. And we don't know what that looks like yet long term. So I guess my message here is please do experiment with AI. Please do use ChatGPT as a tool, but please remember to use it responsibly. All right, let's get into it. Grab yourself a cup of tea. You're going to love this one. Hello, Tessa, and welcome to the fireside. How are you today?
I'm so well. I'm all the better for seeing you, Becky. Thank you for inviting me to talk to you today.
And welcome to my new video format. This is new for this season.
Hopefully, I'm not going to put anyone off of viewing subsequent episodes.
Hardly, far from it. Now, first of all, with all my guests at the fireside, I like to ask, how do we know each other or how did we connect? And I think it was years ago, wasn't it? What a while.
I would say, like, if I was put onto like a lie detector test, I would say 5 years and hope that I passed, because I'm pretty sure it's about 5 years. I feel like it was around the time of COVID.
Was it? I reckon it was before that, but okay. And then we connected through, I think it was like Health Consumer World, I think.
I believe so. I mean, I feel like I noticed you first, and I feel like it was because you've got such a great online presence. I was like, this lady is someone I need to know. And I also believe, like Adelaide networks being what they are, that I had also heard about you through my network. So you were a bit of a sort of, a guru, and I knew that you had some very good information and advice to share. So I think I reached out to you because I was, at a point in my career where I was wanting to take my volunteer work and turn it into something a bit more professional. And I thought,
which you have been doing.
Now,
and we're going to talk about AI and ChatGPT, but something that before we get into that, I want to bring it really, really human, because something about that conversation we had way back then was I remember us talking about birth stories. And I'm sure out of that conversation, I came away thinking, gosh, we don't talk about childbirth enough. And so part of this season is me talking about myself and things and real stuff that affects real people. And women do make up half of the population, and I would imagine a large percentage of them give birth to children at some point. So let's just go there. How many children have you got? You've got a few, haven't you?
Yeah, so at the time that we would have met, I had 3 children, and I now have 4. So they're currently 16, 14 and 12, and then 1-year-old. So I've decided that I would just go back to the start again, because why not?
Why not? You've got nothing else to do. Let's have another baby. Well, mine are now 13 and 9. And so, yeah, maybe it was 5 years ago that we chatted. Let's do a very quick, for anybody that's pregnant and listening and about to give birth, let's do a quick, how were your 4 births? Were they different? Were they the same?
They were very different. So the first one was a private sector birth that turned into an unplanned cesarean. That was extremely traumatic. And so that is, 16 years ago, what lit the fire under my backside for, 16 years of advocacy. And I have no doubt it's a lifetime of advocacy ahead of me, because every time I think, oh, maybe it's time to walk away, I'm pulled back in. And yes, as it turns out, having another baby has just more firmly cemented my role in that community. But yes, that was the first one. And I was, extremely traumatized. And it took a very long time to find center after that birth, because it just really ripped my world apart. And I wasn't at all prepared for it. And the thing that struck me was that my my cesarean was really a textbook cesarean with what the clinicians would all consider to be a perfect outcome because the surgery went ahead and was, didn't have any complications. It, had a live, healthy baby at the end of it and a live and healthy, in inverted commas, we can do that on the video now, mum as well. And I thought, well, as somebody who had just come out of education, because I've been teaching for 5 years, I thought, you're measuring the wrong things. If you're not getting my part of the story into your KPIs and you don't understand that while I was physically healthy, you actually sent me off completely traumatized and not functional in my life for a very long time afterwards, and created a situation that put pressure on all of my personal relationships, my relationship with my son, and all sorts of things like that. If you're not getting that part of the story, your KPIs are wrong. And so that thought has basically sparked 16 years worth of advocacy and trying to eat that elephant from all sorts of different angles. After that birth, I then discovered private midwifery, and the fact that we had that model available in South Australia, and I had no idea. That allowed me to then birth at home and have a vaginal birth after cesarean or a VBAC at home with the next one.
Wow.
Then repeated that again with my third baby. So she was my second VBAC at home. And then with my last one, who, there's a big time between drinks. I thought, well, I don't want to go to a hospital because I know that for me, home works better. I am a lot older now. I am a bit fatter as well, if we're honest, but new risk factors, let's just say. But I still trust that home is the right environment for me. And I managed to get the same midwife. So she was still practicing.
Wow.
Available. She was in the right state because she had moved for a bit. And so I got to have, basically like 14 years worth of continuity with the one midwife who has seen my last three births. So, it was amazing.
Wow. And imagine if you hadn't done that sort of self-advocacy after that first birth, you may not have gone on to have more children, or you may have just followed the same path as before. And we'll get onto this self-advocacy thing. I find it fascinating that, I mean, my two were very different as well. And I think that's probably the main message a lot of women say, isn't it? My 13-year-old I was told, in fact, my doctor told me, just walk into the hospital and say epidural. When they say, what's your name? Say epidural. I was like, okay. I was told not to go to our local hospital. We have a local community hospital here in the south of Adelaide, and they did a postnatal care system. She said, don't bother with that. It's not very good. So I did what she said. I just walked in and said epidural. And it ended up being from start to finish like a 36-hour birth that
Goodness.
I couldn't feel when to push. It was weird. It was hard, really, really hard. Obviously, lovely ending. But then my second birth, I was a lot more informed, but she was just completely different. She came within 3 hours of, the first contraction and then just shot out. And I didn't have time for anything, barely had time for gas and air. So just the two comparisons. But really interestingly, after that first experience of being told, don't go to my community hospital, I then did a bit of research and I ended up on the board of management for that hospital. I still advocate these days for that hospital. And it all came from that original birthing experience of just being told by a local GP, don't do that and just do that.
That's
I realized
right.
we've got to be so much more informed, haven't we, as health consumers?
And to recognize that we don't get to do a do-over, and I mean, okay, maybe I did in a bit in that I've decided to have a fourth baby in my 40s, which is a bit of a mad decision, but one that I absolutely don't regret. But, women, these moments, like you don't get to do that birth again, and so these moments are so precious and should be treated with care and the level of respect that is due any rite of passage. And yes, we have got services in South Australia that see 5,000 births a year. And so those staff are seeing births so regularly that maybe, some of that shine comes off or you sort of lose yourself in that kind of volume. But we really have to remember that, this is super special for every family, every woman who is going through this and give it that kind of reverence that it deserves. I mean, every human on this planet represents a woman who has gone through an experience of birth.
Yeah, wow. Yeah. And actually, my oncologist for all my cancer treatment just announced to me a couple of months ago, she said, I'm pregnant, I'm going on maternity leave. And it was the most beautiful thing. So I took her a little gift for her last appointment. And I just, because it's so special. And, for me, in my deep thinking way, I was really like, it's, a real full circle of life thing. And, an oncologist who's treating people to try and stop them from dying, who's then having a baby. It's just all lovely. So, anyway, let's fast forward to now. Actually, you've had a recent birth, so actually, it's kind of now. But I spotted you on. You're very great. You're amazing. You're very. I want to say prevalent. That sounds negative. You pop up in my TikTok feed a lot. I'm not on TikTok a lot, but when I go on there you are talking about amazing things. And I noticed over the last year, I think it was since your birth, you had a baby and you ended up in hospital. What happened? Tell me the story.
I did indeed. So the universe has its way of making its point, and if you stop listening, it just keeps making the point to you. So I had the baby, Sid. We'll give him a name.
Oh,
So I had, Sydney. So I had Sid in November last year, and quite consciously decided that because I'm in a different place in my life and have different pressures and priorities, I'm not going to take the time out of my work and career like I did the last time, and also now in my 40s, I don't have the runway that I had before to like completely reinvent myself on the other side of birth. So I said, right, my intention is that I've got really important work that I'm setting up. A lot of it was related to Gen AI. I am going to keep this running. And so I took a very minimal amount of time off and positioned myself so that I could return to work within about, sort of 3 months, but was realistically like back on the computer and in Zoom meetings 10 days after birth and had
wow.
been,
Yeah.
helping with grant applications and things up until like, 1 week before as well. So I really
Yeah.
didn't take a break. And I was doing okay with it. We managed it. Sydney was super easy as a baby. His dad has already got an older child, so he's very experienced. And so that was all bubbling along quite well. I'd returned to actual office work as well, and that was fine. And then we got to June, and my partner decided that he would go to Kaipo Forest to enjoy the winter solstice. And I was like, nice for you. I'm not going to be having a holiday like that anytime soon, but off you go. And so as a result, I woke up on Sunday morning and, was just running around kind of doing normal mum things. I probably should have downloaded your app actually so that I had it a bit more under control. But I was, one child's in the car needing to go to her dance performance rehearsal, and Sydney was sort of crying and needing a bit of attention. And I just finished doing a little bit of admin work on the computer. And as I was about to go out the door, she'd already put Sydney in the car. I thought, I need to go and check the washing machine because I feel like I've put it on the wrong cycle, and that is going to be a problem for future me when I get back and it's still running. So I moved at pace into my laundry along my terrazzo floor. And as I went to turn and check out what the washing machine was doing, my foot landed onto an ice cube that one of the children had unfortunately left on the floor when they filled their drink bottle up at the fridge, and just let the ice fall, as you do as a teenager, because it magically disappears and you don't need to pick it up. So,
Yeah.
just a series of really bad events. So my leg kind of went out from under me. I knew that I had injured my knee before I even hit the ground. So the actual sort of twist on the knee actually is what gave me a double tibial plateau in my right knee. And then as I landed on the floor, I also additionally broke my right arm and was in instant pain, more pain than, the 12-hour unmedicated home birth of Sydney, who was 4.75 kilos. So I had a fairly recent reference point to know that actually this is quite serious, this injury, because this level of pain is out of this world. So
Got
so that was
just as you're
dramatic.
talking there, I'll come actually to my little story. And my mum had a fall recently, and she's fractured a femur. It's pretty bad. But she said she made the comparison. She said this pain is worse than childbirth. So that's funny that you mentioned that. So
Yeah,
I think, yeah,
yes.
wow.
I mean, maybe if I went back and told me in labor, hey, don't worry, this isn't the worst pain you're ever going to have, maybe I would slap current me if I said that to me. But look, my belief was that, it was definitely more painful. And I guess in childbirth, at least you get like the little mini break in between the contractions, so you do get moments where you remember how not being in pain feels. Whereas, yes, with a break like that, you're just stuck on the floor and in constant pain.
Right, I'm laughing because I'm just imagining you now telling the previous you but yeah, don't worry, at least you get a break.
Yeah. Oh, don't worry. Just like make the most of it. Okay. It's not so bad, is it really?
Oh dear. Well, look, it's all a lot of pain. So I assume you called an ambulance or help
So
yourself.
luckily, my 12-year-old was in the car. Sydney was in the car with her, and my eldest, my 16-year-old boy, who's as the young kids say these days, fairly nonchalant, was in his room gaming away and had heard that something had maybe happened, and that sort of awoke him from his gaming zone. And he sort of came in, he's like, "Are you all right?" And looking at me like, he's quite puzzled. I'm like, no, you need to ring an ambulance and you need to tell them our address. And then you need to ring grandma and grandpa and tell them that they need to come here. And then you need to tell Ruth to bring Sydney inside. And he was like, oh, okay, all right. So he went off and I could hear him talking to the ambulance. He tells me later that they said, can you estimate her weight? And he said something like 130 kilos or something like that. And I was just like, oh, okay, that probably explains why they came to the door with quite a lot of equipment because they were expecting a different situation, I guess. But yeah, so he doubled his weight, bless him, at 16. He has no clue about these things. So yeah, so he rang the ambulance. They came. Um, and my mum arrived just before they did, and she got into sort of trying to organise people mode quite quickly.
Yeah.
And then the ambulance came and they gave me the green whistle and then built a stretcher around me to get me off the floor because there was absolutely no way they were going to move me out of my laundry floor, so off of the
Oh
floor.
my goodness.
Yeah.
So sorry that happened to you. Such like a split second moment, or like you say, a series of things that just led to that awful thing. And so how long did you end up being in hospital for?
Yeah, so from that moment on, I went to ED. I was in ED for about 24 hours
Yeah.
and then was in hospital at the public hospital because, as luck would have it, I had only just spoken to the broker to set up my hospital insurance 4 days prior, and I knew that there was a 7-day waiting period. So, through the pain and in the ambulance, the paramedic said, yeah, are we taking you to the private hospital or the public one? And I was like, I actually am not sure because I feel like I could probably talk to them and get my cover, but I also don't want to be incredibly in debt if I make that call
Yeah.
wrong. So we
Yeah.
ended up in the public system.
Yeah.
And yeah, so that was 2 weeks. And then I actually discharged from there to the Medi Hotel at the Pullman in Adelaide. And that is a new service that was set up in February. So I was, yeah, among the first to use that service. So
Wow.
yes, it was a good little moment to do some covert user experience
That's
research.
actually
So,
that's actually really interesting because I have international listeners to this podcast, and I know I've just again my mum's been in hospital for a couple of weeks with her fall, and I've said I've got to stop comparing countries, but it's really kind of interesting to compare the countries because I know that talking to her with the NHS was very different experience. You certainly don't get checked out to a hotel where you get a kind of a medical experience, but in a hotel, it's like a halfway house almost, isn't it, between hospital and home? That's
yes.
phenomenal.
Yeah, so basically they've just like converted a couple of floors in, what is effectively a five-star hotel and still operating as a five-star hotel.
Yeah.
And you share the entrance and the reception area. So anyone coming to visit me was coming through alongside hotel guests. But they have obviously gutted the rooms to an extent and made them, to spec. So, lino floors for cleaning and,
Yeah.
lots
Yeah.
of things like the shower screens and things are removed
Yeah.
and hospital beds are installed. So, yeah, so they sort of retrofit and make it more like a hospital. But you've
Very
got the
clever.
benefit of being in the city. You've got the benefit of, yeah, being closer to services that can Uber Eats in decent food and, more sound soundproof rooms and
Yeah.
things like that. But
Wow.
there's other flip sides too. Increased costs in parking for anyone
Yeah.
who came in. And
Of
David was coming
course.
in every day with that's my partner. He was coming in every day with our son, and
Yeah.
yeah. So it
Yeah,
was a
you're
bit of a
suddenly in a
mix.
city and you're suddenly, yeah, for people that are outside Adelaide, yeah, the hotel's right in the middle of the CBD, isn't it? And yeah. And did you,
It hasn't got street parking really. Like you really have to pay or get lucky pretty much. So
yeah.
yeah.
Did you experience the hospital at home service at all? Did they come to you ever? Because I had, when I had surgery last year for my cancer treatment, I was so impressed that they checked me out of hospital. I was actually treated as a public patient in a private hospital, which was amazing, just as luck would have it. Again, people overseas will be like, "What?" But it's how it works in Australia. And then when I was checked out, the nurses came to me for probably, I think I had them for a couple of days, just each day came and checked. And again, my mum is having to like get in a car and go to the local GP surgery. And I'm like, don't you have a hospital at home? Did you ever experience that?
So the hospital at home service is actually run by the same group that also run this Medi Hotel and have the contract to do that.
Yep.
And so, yeah, I was expecting that there would be some sort of care that would follow me into my discharge home. And it seems like my opportunity to give some feedback to the service, which I will do at some point, is that they need to better understand the end-to-end experience for anyone coming in as a public patient and then being discharged to this service and then discharged out of that service to home. Because
Yeah.
what happened was I started out as a public patient. In a government-run hospital, they then do the handshake to the Medi Hotel, which is really a private
Private.
enterprise, but
Yeah.
funded by the government, so that they can take rehab patients like me,
Yeah.
among others, like sort of low. It's intended to be low acuity.
Yeah.
I think they've found out in reality there's slightly higher acuity being sent
Yeah.
there than anticipated, as you can
Yeah.
probably imagine. So then you go into this space that's a public-private partnership. And
Yeah.
then the physios and the allied health professionals who are coming into that space are actually private practitioners. And so
Right.
they come in as contractors. And then what that means is that when you discharge, in order to maintain continuity there, you either
Yeah.
have to dip into your own pocket and cover these private professionals maintaining
Yeah.
their connection with you, or you have to basically be readmitted into the
Yeah.
public system and then hope that you can find a spot in the program. So it just creates a bit of a disjointed nature when you look at it as an end to end. And my concern as a citizen is that for folks who are going into the public hospital because they can't financially afford to maintain a private health insurance product,
Yeah.
if they're going into this public-private space, they're then at risk of actually not accessing the care they need on the other side if they can't
Yeah.
get back into the government-run space, or they can't self-fund that
Yeah.
rehab at the point of discharge. So to
Yeah.
me, I think that's a bit of a design blind spot, and
Yeah.
it's one that needs to be ironed out.
I have no doubt you'll be getting onto that.
Oh, absolutely.
Let's get on to what I am here to, because I love all this stuff, and hopefully this is all interesting and useful. Especially like I'm thinking the international people will be just blown away by the Australian health system. Um, Tell me about your relationship with ChatGPT. Should we talk about your relationship in general? Because I have a very strong, he's mine, no, she's mine, let's say, by the way.
Yeah.
I am
So
married to ChatGPT, but tell me about your everything. But I specifically want to hear about how you use ChatGPT in your hospital stay.
yeah, no problem. So I discovered ChatGPT in November 2022 because I was a TikTok user and I had noted that a lot of users were suddenly talking about this thing I'd never heard of. And I
Mm.
thought, this seems like it's kind of a big deal. I don't know what this is. And I jumped on straight away and gave it a go. And I think for anyone using generative, LLM technology for the first time, your mind is just kind of blown instantly. I couldn't believe what was on my screen. I sort of jumped straight to, how can we solve the housing crisis in South Australia? Like all those sorts of big questions that are burning a hole inside of you. And I just couldn't believe the level of, structure and I'm going to use the word intelligence with inverted commas again, but, that level of, insight that was coming out of my conversation with this machine. I was like, my goodness, I don't believe this. And I went straight to work because I was working for a tech company at the time and spoke to the developers and said, have you heard about this thing called ChatGPT? They said, no, they jumped on. They were like, oh my goodness. And I said, it can code and stuff as well. They're like, what? Oh my gosh, our jobs are like on the line. So I gave them a bit of an existential crisis as well, but they quickly pivoted and recognized that actually this can augment my flow and do all sorts of amazing things. So from that point on, from 2022, like I've just been like fully committed to trying to find the edges on this technology. And obviously, as you would have done, like riding its changes as well, because, with each new release, there's a slight change to the model and its capabilities. So we're having to try and keep up, and it's a good excuse for having constant communication with it, really, isn't it?
Yeah, we're addicted. I will say, actually, you were the person that I saw speaking about it, and you were, again, I don't want to be negative. You were going on about it. You weren't going on, but it was like consistently popping up saying like, how can this be used and how are we using this? And this is my thoughts about ChatGPT. So thank you. And I didn't realize it was that long ago that it certainly I've been using it maybe about a year, I would have thought. So you've been on it since day dot. And you really are leading in terms of being across it in my mind. So okay. To keep going.
The health bit. So yes, I obviously found myself in hospital quite suddenly in a lot of pain, on a lot of drugs. And as we know, once you are in a circumstance like that, you're very vulnerable, and your experience as a patient, which is your one unifying point of all the experiences that come into the room from clinical conversations and imaging results and all of that sort of stuff. It can be really hard to hold a space for your own experience and articulating that when you're also in incredible pain, you're stressed, you're anxious, and also on drugs that are meaning that your brain isn't working in the way that it normally would. And so, do you know Paul Edgington?
I know the name. How do I know Paul Edgington?
He's on LinkedIn.
I do know him, I reckon.
He's one of our local people, and he sort of came to my mind while I was sitting there going, oh my gosh, this is so ridiculous because I'm having to repeat myself and I'm sort of feeling like I'm forgetting some of the information that I'm being told and stuff like that. And he is very passionate about the concept of telling a story once. And so has done a lot of work in that space to work out how our systems can empower people to just tell their story once. Because why do I need to tell my story multiple times? And that's a problem. It's a risk for everybody who's asking me to do that, because every time I tell my story, I might leave out information or slightly change the way I'm saying things, which means that everybody who's responsible for my care is maybe slightly misinformed to a different degree, and unless they're talking to each other, who is determining what's actually real here? So I thought, okay, I've got Paul in my head and I've also got my phone in my hand, in my good hand, the one hand that's working. And so I thought, I'm going to just do me. And what I do in circumstances like this is I turn to technology, and I have ChatGPT available. And so I did something like this, and I'm hoping that my Wi-Fi is going to work okay. We're just waiting for it to boot up. Here we go. Hey, can you just introduce yourself to everyone for Becky's podcast today?
Absolutely. Hi, everyone. I'm Tessa's Advocacy AI GPT, and I'm delighted to join you on Becky's podcast for the love of community engagement. During Tessa's recent hospital stay, I helped her in all sorts of practical ways, from documenting her care to staying connected. She'll share a few of those examples with you today. So let's dive in.
There you go. So you've just heard my GPT, and so because it's got that hands-free mode, I was able to in my hospital bed just activate that, and thank goodness I had enough battery that I could do this, and just dictated to ChatGPT like what had happened. This is what happened, these are my concerns, this is what I'm feeling in my body, so far this is what I'm being told, can you please write this up as a short summary? And then I just basically screenshotted it so that when anybody did come in and talk to me, rather than me having to verbally go through it again, I could say, look, here is the record of like what has happened to me. Please have a read and then we'll talk. So yeah. And then from that point on, we just kept going. I was like, okay, I am my own use case. I am the live action research. I don't need any ethics approval for this. I am going to do this. So from that point on, I just consciously decided to apply this technology to every aspect possible of my patient experience over the next 4 weeks.
This is absolute gold. And what you said about having to repeat your story is so true. I've found that in my own breast cancer experience. Even like it was June 2024 when I was diagnosed, and then I had surgery in July 24, radiation in August, September 24, and then I started my hormone therapy, and then that's for the next 5 to 10 years. But even now, however long it is, 18 months on, I'm still turning up for a scan, and they so tell me about what's going on then. Like, really?
And
Like, so
look,
you were diagnosed, like, what? We have to go back. And then they say, like, how did you find the lump? Like, what? I have to go over this again?
I
And
know.
yeah, so
And I sort of understand it, like, because to a degree, the clinician is trying to make that connection with you and give you an opportunity to tell your story. And so often it's like it can be from quite a good place where they think they're
absolutely.
offering compassionate care and you an opportunity for your voice to be heard. But what they don't recognize is that their engagement with you is only the tip of the iceberg, and underneath the surface is the 5,000 times you've told your story ahead, before then,
Yeah,
and also potentially the re-traumatization that you're experiencing every time you have to go back over the same
yeah.
territory. I mean, having Sydney 12, no, well, what was it, like 14 or 15 years after that cesarean that I had, even then, when I did actually interface with the public system for scans and the and obstetric reviews, and the obstetrician was like, "Tell me about that birth," and I was like, "Are you serious? Like, you're actually asking me to go back 16 years in time to something that I can describe as traumatic, and I'm not going to burst into tears when I talk about it because it's a long time and I've had a lot of practice, but
Yeah.
it's like, really, like, this doesn't stop being a thing I have to share, like that trauma. Like, there should be a point where I can just say, check my notes or check my GP, talk to my GPT.
Yeah. Yeah, chat to
Yeah.
him. And actually, I will say and this is a kudos to the health sector. I have gained so much insight into compassionate and empathetic leadership from the health sector. In fact, I keep talking about my next book and it's barely even ready, but it's called Have Your Say. And I've got an entire chapter called A Curveball Called Cancer. And it's going to be all about how the connection I felt from the most beautiful health professionals, that they all have this kind of way of talking to you, aside from tell me your story from day dot to now, but they use your first name, they touch your shoulder when there's bad news. Like, they really have this beautiful way. And I think if more of the world could be like health professionals in the way that they communicate and care, it would be a much nicer world. So big shout out to the health professionals for that. How did the health
Absolutely.
professionals respond when you gave them your screenshot and your AI summary of everything?
I don't think they were quite ready for it, but that's okay because I understand that maybe I'm a bit of a freak in that space, and maybe the first time that they're encountering a patient using AI to augment their side of the journey. But I was okay with that because I'm also wanting to uplift the capabilities of everyone around me. And so if I'm there with a broken arm and leg and I'm still in a position to slightly influence and kind of give these people the memo that, hey, consumers are now using this technology, I thought I can't say no to that opportunity. So, yeah, so I think they were a little taken aback. And one of the other things that I did, because I had decided to consciously put so much information into ChatGPT, and by the way, I have my sharing data back to OpenAI toggle turned off. So I was happy to put my information in there because I know that I'm foregoing some of the better aspects of the user experience by saying that I don't want to share that information back to them. But
Right.
yeah, it meant that I could draw upon all of the information that I was collating, and I was using GPT then as a knowledge repository pretty much, so that then when I was finally in my bed and knew that the consultants were going to come around in the morning and see me, and I was aware that, they come in, they have maybe 5 minutes with you, they very much have memorized, I mean, because they're actually registrars and still learning, so they've got their memorized list of what they want to cover with you. They sometimes have a trail of students coming in behind them. So they've also got an audience that means their attention's more on that than actually on you and your experience. And I was like, I've got to play smart because I don't have long to get my questions answered. And so I would say to, ChatGPT, based on what I've told you, please write up the list of questions that represents where I'm at right now in my journey. And so it gave me some really fantastic questions, things that I'd never even considered as a 40-year-old who hasn't broken bones and isn't, yet in my sort of elderly years needing to think about other things like osteoporosis and stuff like that, although we probably all should think about that, to be honest.
Yeah.
But it hadn't been on my radar. And so one of the things that it had said was you need to ask about the nature of the break in terms of the risk to forming a depression that might put you at risk of bone issues later in life, arthritis, pain, and things like that. So yeah, it just gave a really good informed set of questions that I understood, because I could also ask it to clarify what it actually meant or why it was asking those questions, so that by the time the reg came around, I could say, I've got questions for you. Pull up my screenshot, no worries. Ran through them. He was like, "Oh, that's a good question, actually." And then I'd ask the next one, "Oh, that's actually also a good question." I was like, "He's going to twig eventually." But anyway. But it was like it made that interaction more powerful and valuable, and it meant that I was more likely to get useful to me information out of it, and also maybe to a degree put them on notice that I was actively leaning into my own care and expecting a level of consultation that perhaps others may not demand. So so it was definitely empowering.
You called yourself a freak, but you're actually not. What you are presenting as is what's coming, and you're really just leading. And I think it's amazing that you use your own health experiences to test and trial this. And I can sense you're very similar to me in that you're like, well, why not? Of course I'm going to use it. I live and breathe this stuff. Of course I'm going
That's
to open my
right.
phone. I had a similar experience. I've used it quite a bit. I used it for health-wise, first of all, when we were traveling overseas, and my youngest daughter Florence got sick with just like a cough and cold, but she has asthma, so I was trying to sort of keep an eye on it. And I realized, I was keeping a log like, okay, she first got the kind of scratchy eye feeling and the sore throat on this day. And then I was trying to keep up. And I thought, oh, I'll start a note on my phone because that's what I do. And I thought, hang on, I'm not going to use a note. I'm going to put this into ChatGPT. So mine is a she, can keep up. She's called Vivian, actually, mine, Viv. Um,
I'm running Michael. I decided he was Michael to me.
I give Viv the updates, and I say, and actually, we were on a flight from Dubai to Milan, and there was this guy that was really streaming, full of cold, and I swear it was him that gave it. And so Viv took that information, and then next thing, Dan, my other half, her dad, gets the symptoms, and I get the similar symptoms, and so Viv starts keeping this full travel log of all the sickness and a kind of, a bit of a, dare I say, diagnosis as to what it probably was, in terms of what, and we were in the UK by this point, and it was able to say, yeah, around at the moment, a lot in the UK is COVID and is this and is that other, and it's likely with that symptom that it's this. So I was just tracking this whole thing, and then her cough got persistent, even that when we got home, I was able to turn up at the doctor's with this full thing about all the different symptoms and how it all went. That was the one thing I did. The other thing I've done, which is quite serious, is put my blood test results into ChatGPT. I've got a bit of a dodgy reading on one of my blood tests, which my oncologist is all over. But of course, I couldn't help myself but put all the blood test results from the last year in. And it's given a bit of analysis. And I went to my GP, who I know quite well, and I said to her, I daren't even admit this, but I've put the results into ChatGPT. And she was like, what? And then we had a bit of a chat about it, and I've still got a theory from ChatGPT. My oncologist hasn't caught up yet, but what it actually is that's causing this blood thing. Anyway, my doctor said to me, which is the point I'm getting to about you, is she said, I'm happy for you to be using this because you actually are doing it really smartly. You're not just saying, what's wrong with me? Am I going to die? You're actually saying, these are the stats I've got. This is the information I've got. This is my timeline. What questions should I ask my oncologist? What should I ask my GP? So the health professionals seem to really respect it when you use it as a sort of tool, like an aid, isn't it, or an ally? Have you had any kind of responses from the health professionals about your use of it? And I've noticed also since we originally talked about doing this episode, ChatGPT does clearly say, I am not a medical professional.
That's right. They just recently updated their policy. So if you go to ChatGPT wanting medical or legal advice,
Yeah.
it now will block it. But I have found that obviously, as humans do, there are lots of ways to work around that and still manage to get the information that you need. It's about understanding how to ask good questions. And so I think this brings me back full circle to the most important lesson that I learned, 16 years ago, which is that, if you don't know what you don't know, it's really hard to know where to start and what questions to ask. So, 15 or 16 years ago in the birth space, we were, holding coffee mornings and coming together because we didn't have Facebook groups then even. So we were coming together in this very face-to-face analog way. But fundamentally, it was, tell me what I need to know. Tell me the questions I need to ask. Like that's the kind of information that we were exchanging. And there's still that need to exchange that kind of information between us as consumers and as users of this technology, because part of the uplift is, yes, okay, you need to know where to find it and you need to know how to write a prompt. But the first prompt that you need is, how do I use you? And then you can basically follow the bouncing ball from there. So that's not necessarily as hard as understanding how to be a good critical savvy consumer in these spaces. And those skills that we need to learn, we learn through talking to each other like we're doing today, exchanging ideas, understanding that, hey, you could ask your GPT about the policies in the state that you live in or in the country that you live in, or you could ask for some stats about the condition that you have. And so it's just understanding like where to play and the sorts of questions that you can ask. Now you can have that conversation with your GPT and just say, like, act as an advocate and tell me what I need to know, like what should I be asking to be a savvy consumer? So you can kind of like, approach it that way. But
Yeah, and so people that are listening, I know I'm going to tell my mum to listen to this because she will love it all. And she'll be saying, "How do I get this thing?" So you go to the App Store on your phone, wherever you get your apps from, and you search ChatGPT, and you get it as an app on your phone. And I've got it on my computer as well. So I go to whatever it would be, AI dot. Well, I don't know what even the address is for ChatGPT on the website.
Yeah,
And
I think
ChatGPT,
it's now just chatgpt.com. So it used to be something different, but I think they've now just shifted it across to that because that's easier.
I use the voice one a lot because
That's right.
when I'm driving, I do all sorts of, or if I go for a walk, I'm like, hey, I've got this idea. And somebody said to me recently, like, oh, what was your prompt? What prompt do you give it? And I say, I just talk to it. I just
That's
ask it as
right.
if I were saying, hey, Tessa, I'm thinking about doing something on this topic. What could I do? And it will give you some suggestions, and you say, I like that one.
Absolutely. See,
Yeah.
I love using it when I'm driving as well, because to me that's dead time if I'm not using it productively. And so I will often have it on hands free, have it suitably mounted so that I'm not breaking any laws, but talk to it and say, I need to troubleshoot this problem. I'm trying to work it out. And then by the time I get to my destination, there's a transcript of our conversation, plus also the output. And so often I will then, arrive at my destination with the work done, and I just need to cut and paste it out of that environment into wherever I need to turn it into something meaningful. So it's so good for productivity that way. It really is. So people can get it either as an app, or you can get it just through your browser. So whether you're running Chrome or Edge or whatever, you can just go into the address bar and just type in ChatGPT gpt.com, and you can use it without an account, but having an account allows you to save your chat sessions, and then if you want to pay for a subscription, which I have been doing for 3 years, if you want to pay for a subscription, you get some extra perks on top of that. So there's a range of ways that you can kind of opt in. There's also other products. I mean, we're doing a lot of talking about ChatGPT because we're fans, but Copilot, which is Microsoft's version, that is also freely available. And Microsoft are a massive partner and funder of OpenAI. So they're actually running the same technology under the hood. But it's just that for some people, if you're in an environment at work, for example, that is running Microsoft, you might need to get yourself familiar with Copilot. And you can, again, put that on as a free app on your phone and have a play. So,
I pay for it now. Interesting you say you've been paying, because I was using the free version for a year or whatever. And it's the only product I have ever said, this is so good, I feel I should be paying for it. As in the free version, I was like, this is free? I can't believe it. But then I decided to pay. And in fact, I still just do it month by month. I cancel it every month. I don't want it as a rolling subscription, but I just find the paid version, because I'm using it a fair bit with big documents and like looking through things and stuff, it definitely handles it all much better when you've got the paid version. In terms of
Yes.
the health system, then, how are they getting ready? You mentioned Paul Edgington earlier. He's a friend, and I'm going to have to look him up because his name flashes up for years ago.
And I
Is he?
haven't spoken to him for so long, so we are definitely overdue a coffee. I think I'm going to hit him up and tell him that I name dropped him here, and that'll be
He's
my
gonna,
excuse.
yeah, he's gonna get tagged. He'll be like, "What? What have I
What?
done?"
Me?
So
Little old
does he?
me?
He's a friend of yours, but does he work in the health system?
So he has been aligned to those sorts of spaces for a long time, and was connected to SYC here in Adelaide, and now is running the CEO of Advantage, which is his podcast. So yeah, so just one of these people who has his heart in the right place, understands human systems from all sorts of perspectives,
Yeah,
as well as some of the tech solutions that we could be applying to the problems that are
yeah,
the legacy problems that we keep avoiding. So
yeah,
yeah, so I mean, if Gen AI isn't the perfect opportunity to be solving this tell your story once, I don't know what is. But one thing I thought I would mention that was just an interesting observation I made recently was I was at the conference, the annual scientific meeting for the Royal College of Obstetricians and Gynaes, so
yeah,
RANZCOG, and that was here in Adelaide about 3, 4 weeks ago, maybe. And what was interesting to me was that AI was clearly on the agenda and being discussed, and also being investigated by a lot of clinicians who are looking at it in terms of their productivity, their side of the fence, and what they may be able to then offer patients if they take this technology into their ecosystem. But it occurred to me sitting in the audience with my perspective that this is good and it needs to be done, but your patients are walking in the door with their GPT in their pocket, and
yeah,
or their preferred LLM, and so I think for me, one of the conversations that the health sector or any big sector could be having right now is, once we pick up this technology on our side of the fence, there will be a portion of the people we serve who want that made available to them from us top down. But there's going to be a portion who have actually already got their preferred behaviors around this tech, and they're bringing it in. So are we going to set up the capability of offering APIs so that I can come in and say, well, actually, it's good, it's great that you've got that product, respect, but Michael's my preferred point of contact here. So how about you just sling me your API key and we'll just go from there. So, my ideal as a health consumer would be that these forward-thinking organisations actually consider my ability to plug in safely and responsibly, and to consume my information out of their system into my system, which I then take responsibility for. And if I want to, send all of my health data everywhere, that's on me, But I feel like there's something there that is missing from the conversation currently. That's a real opportunity, and maybe it helps to offset the risk on this side of the fence, because the consumer who's opting in is taking liability for that side. But then it means I've got access to better functions and a more agile space that operates the way I need it to operate, instead of me having to wait for the health sector or education or whatever to catch up and give me a suitable solution.
It's a bit like the social media ban for under
Oh
16s
my
in
gosh, don't get me
Australia.
started.
Don't get me started either, but they're a step ahead. My kids are already like on other stuff now. They're like my
Absolutely.
9-year-old even. She's done with YouTube. I mean, she's watching it a bit. She's on something else now. I'm like, what? So
Yes,
the consumers are moving faster than the
that's
government
right.
can move. Yeah,
Absolutely. And I mean, they're just going to end up playing whack-a-mole, because the kids have already worked out, as you say, that there are
yeah,
alternate spaces.
yeah,
The government still can't really even properly define what social media is. And this is madness. So really, like, this is the teacher in me, but I know you feel the same. It's about, how do we actually empower people to do things in their life from a place of informed decision, informed consent, and actually just understanding like what the opportunities are, and making good choices. It's like, it's better to come at it with a carrot and just saying, look, we recognize there's a problem, but we're in a position to help you, to help you. Like,
yeah.
to me, that's better than trying to govern the life out of everything and then cutting your nose off to spite your face. Because, these kids, if they get access to this technology, they're going to be the ones who can potentially use it to solve the problems they need to solve for themselves and their children, because we haven't managed to do it yet. All we've managed to do is create an algal bloom crisis. So another side topic that we won't touch today because that will be 3 hours long. But I feel like we have a responsibility to give these kids a chance to be the best users of this technology possible so that they are in a position to solve the problems that we've left them with.
Oh, I completely agree. And my children and I all agree it's our generation that's the problem here. We're the problem. And yeah, there's so much to be done in all of those spaces. And I think, yeah,
Absolutely.
banning technology is weird. In fact, it's funny, on the way to school every day, we drive past a banner from the local council, which is aimed at the 65 plus age group. I think it actually says seniors something, and it says get online question mark. And it's a workshop to help them get online. And my 13-year-old just curses it every time she goes.
Oh my
Like,
goodness.
but they're kicking us off. Like, what is going on?
It's
Yeah.
it's and I mean, from the community engagement perspective, as you know, it was a 24-hour engagement, which is so absolutely woefully inadequate for the level of impact that this has. And plenty of commenters or commentators online have said this. I'm not saying anything that's a new point to anyone, I don't think, but this isn't just about governing those kids, 16 and under. It's about everyone, because everybody has to prove that they aren't in that age group. So it actually impacts all of us, not just them. But that aside, it does impact them, and they haven't suitably consulted that community. So that also is a madness to me.
And I hate the whole like, I'll just go we'll get them outside. Let's go and climb a tree. Honestly, don't be so patronizing. It's ridiculous. On that note, I need to keep us moving because we're almost out of time. The future and moving into the future, like I quite like what you were saying about it being individual responsibility. I think this is putting me on a particular political side. I don't know, an individual responsibility that we walk into that healthcare setting with our own ally. You've got Michael, I've got Viv, and we all have I don't know what the title of this episode is going to be yet. Something about, I'm married to a robot, or my health consumer advocate called Michael. Is it what you mentioned to me previously before we hit record, that organizations are starting to get ready for this? And is there an AI person or something in the health sector at the moment? Like, are they preparing for it?
Yeah, so I'm hoping that it's okay for me to put this out there because, I mean, it's public knowledge as far as I know. But in South Australia, so for the international listeners, the public health system is organised into local health network, which are just sort of health networks, which are just regional areas. And so we have one north, we have one central, we have one south, and then there's a more regional one. The Southern Local Health Network has recently appointed an AI officer, and I know that the Women's and Children's Health Network has also got a similar space that is emerging around AI, and they've got people responsible for that. But I have a direct contact to the Southern Local Health Network because the AI officer is a dear friend of mine. And yeah, he, like you had seen what I was doing online, posting my sort of live updates in terms of the different use cases I was finding for this actually while I was still in the hospital. And so he came in and visited me a couple of times, and he's, in the process of setting up some, frameworks for that part of the health sector to start bringing this in responsibly and in a way that recognises it. While we've got some people who are the early adopters who are running ahead, who need the sort of guardrails and the policy and the guidance, you've also got the responsibility to catch the laggards who need that kind of training and the support to catch up so that everyone's, got parity and equal access to, being the best contributor to our health system they possibly can be. So, so I spoke to them recently. He's got a group of AI champions from across that network. And so I spoke to them recently and shared my use cases with them. And I think, although they're aware that this is a thing and that people are using it, I think because I was able to give some quite disparate use cases that probably challenged maybe their thinking and just broadened it a little bit in terms of how this really can impact every aspect of the episode of care that a patient has, including their discharge, including, everything before as well. So, so that was a really exciting opportunity.
Well, if you send this to the people in the Southern Adelaide one, I'm one of them and I'm all over it. So tell them I'll be a person. I'm using everything.
I
Yeah,
should name drop Guillaume Leroux, and I will send you a link to him on LinkedIn as well, so that
love that.
he can join the tags.
Love
Yeah,
that.
and I thought, look, just super quickly, I'll rattle off a couple of other use cases before we close. But
Yeah.
I had Tell Your Story once. I was using it to help interpret information being given and help track the information I was being given. I was also using it to track things around compliments and complaints based on the sort of care that I was receiving, because I knew that providing feedback is important to me, but I wasn't in a position to remember anyone's name or what happened when. So I was brain dumping a lot of that stuff in, and then I was able to provide some good feedback after my experience. And then another wacky use case, which I think is one that we could spend a while talking about another day, perhaps. But because I was also aware that family and friends were coming in and sharing things with me or sending me messages online, and I was consuming that information from a fairly drugged up state, I was consciously feeding that stuff into my GPT. So taking photos of cards or screenshots of messages and things like that, so that when I knew that someone had told me something good that was really good advice that I should remember, I wanted to hear someone's voice, the GPT could recreate that for me when I needed it, because I wasn't in a position to get up out of my hospital bed and go over to the room, other side of the room to read the card, or I wasn't in a position to necessarily remember that message I read 2 days ago, and I couldn't remember if that was on Messenger or Instagram or Snapchat. So it just became a point for me to maintain my connection to the beautiful goodwill that was coming towards me from family and friends. So yeah, that
Wow,
was.
those are some brilliant tips. I hope we've inspired some people. I'll just throw in my mum had her fall a couple of weeks ago, and I'm on the other side of the world. And so I wasn't able to be there in the hospital and kind of understand and grasp it all. So I was feeding into ChatGPT all the messages she was giving our family as updates. So it was kind of even like she said something at one point, like, I'm missing my wine with a little emoji and a laughing face or something. And I was putting it all in. And Vivian was amazing because she was saying even stuff about that. She was saying, oh, this is very normal for a femur fracture. Yet being 80 years old, she needs to think about this. You could consider asking this. Has she got access to? It was so good. But even it was even saying she was even saying, Vivian, sorry, you have a name, ChatGPT. She was saying, that's good that your mum's showing humor and that she's missing her wine and that she's using emojis because that's showing that she's kind of with it and together. So yeah, it's our best friend, isn't it?
Absolutely. And I mean, I know that like for some people listening, like they might be hearing, oh my gosh, you're describing my worst nightmare because you're taking these human things and you're turning them into robots. And that's not that's not a substitute. And it's like, yeah, well, I recognize that and you recognize that. This isn't about trying to substitute it. And as intelligent people, we understand it's not a substitute. It's actually about augmenting that experience so that we can open ourselves up to better compassion in the case of your mum, or not to say that you're not compassionate, but,
Yeah.
seeing her from different perspectives that maybe are different to the one that's
Yeah.
in your own head. That's really useful. For me, being able to kind of redigest that information that friends were giving me that was really good advice meant that I could integrate it more deeply. And so that wasn't about substituting my friend and turning her into a GPT. It's more about me recognizing the wisdom there and then using the technology to actually integrate that more deeply into my human system. So yeah, I see this as augmentation and not replacement.
Yeah, wow. I think those are some very fine closing words, absolutely, and that we are smart, intelligent human beings, definitely. Tessa, before I let you go, a couple of quick questions. Where can people connect with you?
The best place is really LinkedIn, I think, at this point in time. If you want to look me up on LinkedIn, my name is super Googleable, so that's great. And you can also find me on TikTok. The TikTok account I run is called Tessa Teachers with an underscore in between. And yeah, otherwise, I hope that anyone inspired by this conversation today who wants to pick up the conversation feels comfortable to do so.
Oh, they will be always the digital themed episodes get good listens. People love the digital stuff. Also, a question I'm going to completely spring on you because I haven't prepped you at all for this. I used to get a song to close the episode, but Spotify stopped letting me do that. So instead, I just ask my guests if you have a song in your mind right now, or have you got a favorite song, or what were you listening to in the car on school drop off, or what? Give me a song to tell everybody to go and have a listen to.
Oh goodness, it's got to be Hey Ya by Outkast, I think, showing my age here because surely that's new, right? That's a new song.
That's a new song. That takes me to Byron Bay as a backpacker dancing on tables back in like 2003.
But
Hey,
I just love that song so much. And then if I can do two bites of the cherry, the other one is by a Russian band called Little Big, and it's called Skibidi. And that was out before Skibidi Toilet and all of that brain rot became a thing. And it's got a really cool dance, and we're playing it basically every morning. And Sid is slowly learning the dance, I think.
that's so good. And again, for our older listeners, my mum particularly, who I've mentioned a lot, she'll be going, skibbity what? Brain rot what? And maybe we should just finish for my 9-year-old by saying six,
Six,
seven.
seven. Yeah.
All right,
They are all
Tessa,
cringing. They are all cringing right now.
it's been so good having you at the fireside. I could talk all day with you about it. Thank you for joining me, and I'll chat to you very soon.
Thank you so much, Becky. It was a pleasure.